what types of treatments do we have to treat periodontal disease? Well, the goal is to get rid of the bacteria and the tartar. Tartar is essentially hardened bacteria that's formed on the teeth. If you can imagine the hull of a ship in a bay, the hull above the waterline looks clean and smooth, and that's your teeth, but then the roots of your teeth, which are akin to the hull below the waterline, have little barnacles on it. Well, your teeth form little barnacles. We call that tartar or calculus. And so our goal in treating periodontal disease is to remove that tartar and calculus. And there's lots of different ways to do it. Obviously, we want to try to do it in the most conservative and pain-free way possible. So typically, we'll do what's called a deep cleaning, or it's also known as scaling and root planing. And that's normally when we give some local anesthetic, which is Novocain, and we essentially scrape the teeth to remove the tartar or calculus, or those barnacles, from the root surface of the tooth. We oftentimes now employ some newer technology, which is not very commonly used, but I find very effective, which is something called a Periscope. And a Periscope is a microscopic fiber-optic camera that we place under the gum line to visualize what we're cleaning. See, most of the time when you get your teeth cleaned, it's being done in a, quote, blind fashion, which is you're just putting an instrument below the gum line and trying to scrape the teeth, but you can't see what you're doing. The Perioscope is an instrument that allows us to actually see what's there, and we can effectively clean it. If we can remove the causative agent, the bacteria and the plaque and the tartar, then the gums will heal. So this is another method that we employ to try to prevent patients from having to have periodontal surgery.